If you've ever considered running a marathon, today's episode might just be the inspiration you've been waiting for. And if you're thinking, no way am I running 26.2 miles, stick with me, because even if you're not lacing up your running shoes, your patients might be. And they're counting on you for sound nutrition advice. I'm Colleen, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. In this episode, we're hitting our stride with marathon nutrition alongside Starla, a registered dietitian specializing in endurance sports. Not only does she have the clinical know-how, but she's also got some serious running cred. She ran Division I cross country and track and field at the University of Houston, and even competed at the 2020 USA Olympic Marathon Trials. So today, we'll break down marathon nutrition step by step, covering exactly what runners need to eat leading up to the big race, optimal strategies for fueling during the marathon itself, and essential recovery tips for after they cross the finish line. Plus, Starla shares the 4 most common mistakes she sees runners make. Mistakes you can help your patients avoid before they become race day hurdles. Whether you're counseling a seasoned marathoner or supporting someone training for their very first race, this episode is packed with actionable insights to help your runners achieve their personal best, avoid common nutrition pitfalls, and cross the finish line strong. So get comfy and enjoy my conversation with Starla. Starla, I'm so excited to get into this topic. Thank you so much for being part of the podcast. Welcome to the show.
Hi, Colleen. Thanks so much for having me today. I'm excited to jump in on all things running nutrition.
Like we were talking off air, I've never had a dietitian come on and specifically talk about nutrition for running. We've done a few sport nutrition and team sports and even individual sports, but I'm fascinated by this topic. I would love for you to just explain to us, how exactly is eating for a marathon different than eating for, let's say, like bodybuilding or another type of sport that isn't as much endurance?
Yeah, so when we think about marathon training, we can think about it in different stages. So there's nutrient periodization that happens throughout the training process, and that can be dependent on a low training volume, a moderate, and a high training volume. And that's going to differ per person based off of their experience level and what their training plan looks like. So we look at typically like a full training cycle and what is their beginning volume, and then what is their peak volume that they're anticipating or their highest intensity weeks. It can really vary per person. Somebody's peak might look like 35 miles a week or 40 miles a week typically for a marathon training cycle for just like an average type of runner or a beginner. And for somebody that could be more experienced, that could be 70 plus miles per week with a long run plus 2 intense training sessions. So very different in terms of training level. Some of the biggest nutrient changes are going to be in regards to carbohydrate intake, and that could be from maybe about 45 grams of carbohydrate at a low training stage per meal, and then all the way up to maybe like 90 grams per meal in a very high intense training week. So that is one of the biggest differences. And I think one of the parts where some clinical professionals aren't necessarily sure on how to guide newer runners, moderate types of runners, or even like more experienced level runners on how to change their nutrition.
I think when providers think about like marathon running, we forget that there are those differences in intensity and the duration, right? Like, yeah, maybe the goal is, let's say 26 miles if they're doing a full marathon, but they don't start out running that. So you're right. The nutrition should change throughout that training cycle. And I love that you mentioned that, because not a lot of providers consider that. And although some of us know that carbohydrates are important, they're a great source of energy, they might not realize that the longer you're running, the more carbohydrates you need. So I would love for you to linger here a little bit and just educate us on the nutrients that runners should focus on. Obviously carbs, but I really want you to dial in on how that should evolve throughout the training cycle. And then where does protein and fat fall in there?
Yeah, so typically carbohydrates are going to change because of the more volume or more intensity. Carbohydrates are going to be that first resource that we're going to pull from. Like, I kind of also like to always draw it back to blood sugars as well. So whenever people are sometimes hitting a wall, feeling more sluggish or tired, and they're unsure why. Typically, that's going to be because they might not be consuming enough carbohydrate throughout their training cycle. Sometimes that can fall to the wayside because sometimes we see folks start out running as a form of exercise for weight loss. And so it's really important to understand that person's journey of why did they start running, and then trying to see as well, like, what is their end goal now? Maybe it's not even weight loss focused anymore at all. So being very sure of where they're starting out from and what is their goal. Those are two separate goals: to finish a marathon and to lose weight. Usually most dietitians that work in the endurance athlete space don't encourage the two either at the same time, because you can fall into a lot of bone stress injuries as well, and a lot of other issues like menstrual cycle loss as well for female athletes in particular. And then we do see even male athletes falling under a relative energy deficit syndrome as well. So we see low libido, low testosterone levels. So some of those more other like panels that can be run to see like how an athlete is actually doing health wise and performance wise at the same time can be utilized. But in terms of nutrients, I always tend to look at carbohydrates first. Protein is also going to change a little bit in terms of from a low to a moderate, but at a high training level, it shouldn't change too much from a moderate. So typically, because we do see some of the bigger appetite changes occur between a low to a moderate training phase, we try to really encourage that as well. And because most of the base phase of the training cycle is going to be at a moderate level, we try to really encourage that so that way somebody can recover properly. And that way, again, they just help their bodies be able to absorb some of that big peak training, because that peak training is maybe going to be maybe in a full training cycle. If somebody does it in a very healthy way, maybe 2-3 times in that whole training cycle, but they always come back down to a moderate. So if I were to put it into numbers for like volume, it could be like if their peak is at 60 miles a week, they'll come back to maybe 45, and 45 might be their base mile training per week. So we always want to come back to that. So that way you can reload and be able to re-emphasize that peak again when they go back up. But typically protein is going to be the most there. And then fats are also going to be part of that. I would say fats are probably one of the most overlooked. So I'm glad that you brought that up, because we still do need healthy amounts of fat. And sometimes some calories are not going to always come from carbohydrates and protein. We still need some of that fat, especially for hormonal production, in terms of being able to have enough estrogen and testosterone to help protect the bone as well. And then to also have enough testosterone for women and for male athletes as well to help with that bone protection. And even just to get some of that performance gain and that muscle and that tissue changes as well. So fat is still very important. I think a lot of people, when they take on marathon training, they try to do a lot of clean eating at the same time, and they forget a lot about those healthy fats. So remembering that part, it's going to be maybe about 20%, 25% of their total intake, depending on the athlete. So I don't want to minimize that either. In terms of micronutrients, I always look at calcium across the board for both male and female athletes. Vitamin D especially is going to be a really big one too. And again, vitamin D is a fat soluble vitamin. So having enough fat in your diet is going to help it absorb. And most athletes are vitamin D deficient, especially athletes that are more melanated as well. So because it doesn't absorb. So making sure that we do check those periodically. Iron is a huge one, especially for those that train at altitude and that don't train at altitude. And sometimes that can be only just checked through iron, but I always encourage people to check and to advocate for a ferritin, because that's going to be a little bit more telling of what's actually being absorbed. Are there maybe some gut issues that are happening underneath everything, and why aren't they absorbing, even if they are doing high amounts of supplementation as well? And then I'll look at maybe magnesium as well as another one to also make sure that things are absorbing well. And just to also make sure that cramping is maybe being resolved differently if something is occurring there. But those are probably like the main 4 usually that I do try to check on periodically.
Now, I love at the beginning that you mentioned that marathon dietitians usually don't recommend that patients start running for weight loss and for the goal of a marathon. And I think people forget that because it is really difficult to achieve both goals and optimize your nutrition for both things. This is why it's so important to work with a dietitian who specializes in endurance sports, because even for me, I actually trained and ran a full marathon and I lost a lot of weight. And I was eating, but I probably wasn't eating enough carbs and fat. You know, as women, we're told to avoid those and we're like thrown in our face constantly that they're bad, they're negative, they're not helpful. But for endurance athletes, they're so important.
Yeah. And I'm just going to piggyback off of this too, but some people do experience weight gain during a marathon training cycle, and that can be really frustrating for people. And they're like, what's going on? What's happening? And that can vary per runner as well. Like even life stage wise, like for menopausal women versus non-menopausal women or perimenopausal women. But I do think like if somebody is gaining weight during a training cycle, they might not have been eating enough to begin with, pre becoming a runner. And just because of the amount of training, you do get very hungry. Or what ends up happening is that there are changes in appetite. So when somebody does more stress, like physical activity, it is a stressor and it's a positive stressor. But we do see people lose their appetite after big training runs, and then they don't eat anything. And so then they get really, really hungry and ravenous. And that's where they might just start overeating later on in the day. Or another scenario that I typically see in this weight gain category during marathon training is that they just need a little bit more help on figuring out what to actually eat throughout the day because they maybe don't have enough time. They're already running a lot of miles as it is. They have a job as well. A lot of people that start running and doing marathon training, they're not full-time athletes and they're not professionals. And we're seeing that huge boom happen right now.
How frustrating to be gaining weight while you're running more miles, right? I mean,
Yeah.
it's got to be so disheartening for patients who that occurs with. And this is why I say all the time that nutrition is so nuanced. I mean, you can hear it in Starla's answers that it depends on the runner. It depends on the patient. It depends on their life cycle. It depends on where they are hormonally. So many things. So that's why this black and white type of nutrition advice never works. And that's why I love having dietitians come on and unpack it for us so we can give better advice. So I want to move into timing because this is a really kind of hot topic, I would say, in the weightlifting world, but I feel as though it's super important for endurance athletes. So if you can just give us some idea of strategies for timing meals and snacks around those longer runs.
Yeah. So again, that's going to depend on what time that person is starting their run at typically, or what is like their usual time of day. Let's say somebody is starting off at 7 a.m. and they're waking up at 6 to start their 7 a.m. run. So they have an hour window. So the closer you are to starting your run, the more simple carbohydrate your meal should be. There's less emphasis on protein and healthy fats because they just take longer to digest. So the closer you are to the run or your exercise, the more simple the carbohydrate you want to choose. That's not to say that we don't care about complex carbohydrates, high fiber meals, or vegetables. It's just that whenever you pack on all of this slower digesting food that's meant to keep you fuller for longer, it doesn't necessarily always end well in the GI realm of things. And it can really feel a lot heavier on a person. They just don't feel good. So we always want to go simpler the closer to the run. If you have more time, like let's say somebody's willing to wake up at 4 or 5 a.m. and they want to have something that's a lot more balanced with vegetables and maybe some fruit and healthy fats and protein, that is great too. But in terms of like even just thinking about a regular training run and somebody's waking up at sometimes 5 a.m. to be able to get out the door and get to work, or sometimes even 4 a.m. You want to go simple as possible. And sometimes, again, that's going to depend on the length of the run, the intensity of the run too that they're going to have. on how much carbohydrate they might need or how much simple carbs they might need prior to starting. So some examples of like, let's say somebody's running for 45 minutes and they are going to start at 6 a.m. They wake up at 5. They could do something like an applesauce, a banana, I like fig squares a lot of the time. So those Nature Bakery fig squares, like 1 or 2 of those as well might work well. If somebody's running for longer, they're probably going to need like 30 to 50 grams of carbohydrate before they start. So that could be maybe a sports drink and a slice of toast with peanut butter, or a sports drink and a banana with peanut butter. So we're choosing things that are giving us the lowest amount of volume with the highest amount of impact for that person. And most people, just from working with runners for so long now and being one myself, sometimes you just need things that are easily digestible and fast to consume, because sometimes that person maybe has 20 to 30 minutes at most to get something down before they got to head out.
Yeah, really good point. And this is a hard one, I feel like, to convince parents, but also clinicians. We're in this phase of like natural and non-processed foods. I had a 16-year-old, she was a soccer player, and she told me that her dad made her throw away her Lucky Charms cereal. And she liked to have that before practice, like 30 minutes before running out onto the field. And the dad was freaking out because it was so much sugar. And I had to really explain, like, no, she's using that sugar immediately. If that's what she's tolerating and she's thriving and playing really well with that, let's keep that going, because it's a great source of simple carbohydrate. I'm curious your thoughts on that.
I would agree. I think it's a simple carbohydrate. I think too that sometimes like people focus way too much on like sugar and don't really understand like how does it actually work in terms of exercise. It's very different if you're eating something and going out to exercise. Blood sugars work very differently when you are exercising. And the way that you moderate blood sugars in a typical diet without exercise is by combining carbohydrates with protein, healthy fats, and fiber. Because we are removing those prior to exercise and choosing more simplified versions of these carbohydrates, one would think that they would spike, but because now we're using exercise to moderate it, very, very different. If we think about somebody like a soccer player, they are on the field like for a very long time. And especially if you have a very talented athlete that's out there the whole game, you're looking at like 2 to 3 hours. They're probably getting, 5 to 7 miles in just one game. And then through the whole day of doing tournaments, that is a very long amount of time to be exercising. So having more carbohydrates to feed that type of athlete is going to be very, very important. So that's usually the counter argument that I give a lot of people when I do come across athletes like that.
Great example. I love that explanation. Okay, we've talked enough about carbohydrates. I think my listeners understand the importance of that. So I want to move into some hydration strategies that these athletes need to be practicing and working on. Specifically, water intake. How do we know if they're getting enough?
Okay, so typically, if I were looking at just general hydration, typically in like a clinical setting, we're looking at like 1 ml per calorie, right? So if somebody's consuming 2,000 calories, they need about 2 liters of fluid per day. For some athletes, that could be they're eating up to 3,000 calories. So they're going to need on paper at least 3 liters per day. Now, if we look at absorption of these fluids, research shows that you're absorbing fluids much better with electrolytes, protein, and also carbohydrate and some fat. That's why milk is such a great hydration option. And it's also a great post-workout or post-exercise hydration option as well, because you absorb it a lot better. Plus you get the protein, carb, and healthy fat in there too, calcium and all kinds of really great stuff. So when we're thinking about if somebody's hydrated, one of the first ways to test it out is urine color as well. So after exercise, if somebody hasn't urinated for like more than an hour or 2 hours, they probably need to rehydrate a lot more before their exercise, during and after. And then we look at urine color. So if it's more of a lemonade color, that shows that they are well hydrated. If it's too clear, they might just be overhydrated. And so adding in some electrolytes or variety of fluids might be helpful here to help it actually absorb a lot better in that person's system. And then if it's really dark, then they're definitely dehydrated. So we do want to make sure that that person is probably using some fluid options, again, that have a mixture of maybe some protein, carb, and electrolytes for afterward.
I want to linger here about electrolyte replacements because it's kind of like the cool thing to do now. And I find a lot of people are drinking them and they don't necessarily need them. And that's not specifically like marathon runners, but just athletes in general. So I'm curious, who would need an electrolyte replacement?
I typically will look at whether somebody lives at altitude. The second thing I'll look at is whether somebody lives in a hot or humid area as well. And then some of the typical symptoms that they might be having, like feeling lethargic, delayed recovery as well. Maybe they have headaches. There's some mild cramping occurring too, or they notice that they have a lot of GI issues during their run. Sometimes having more fluid and electrolytes can really help with that. But those are just some like quick things that I'll typically look at, or if they're having a hard time tolerating the heat, especially in the summertime as well. And even just considering too, like some runners, they'll frequently urinate during a run. And so that could come back to carbohydrate intake during the duration of their run, how quickly they're drinking fluid, and then do they need something to help them absorb their fluid a little bit more? And sometimes that's an easy way to make sure that maybe that person is not having to frequently urinate all of the time in a big race, especially if it's a big goal race. You can lose like a minute or 2 minutes off of your time. And that can really differentiate for some people going for a big time, whether they get into a big race or they qualify for something too. So I'll consider that as an option if we're into that type of scenario too.
Okay, those are really helpful scenarios to consider. So I want to now move into some race day suggestions and strategies that we need to be implementing. So I'd love to start with, what does an ideal pre-race meal look like? And then how far in advance should that be consumed?
Great question. So when we look at pre-race day nutrition, especially for a marathon, we're looking at anywhere from 50 to 100, sometimes 100 plus grams of carbohydrate prior to your race. Typically, we want to maybe be aiming for three and a half hours before your race starts to be consuming something. So most races start at 7 a.m. So we maybe want to be looking at trying to eat somewhere around 4 a.m. So that might mean somebody needs to wake up before 4. So that way they have enough time to eat something and maybe be done with eating, which is what I recommend, about 2 hours before. Just because I've seen so many runners come to me for GI issues, we try to get them a little bit earlier and to finish eating a little bit earlier as well. Some people can eat up to an hour and a half up to their race, or an hour, depending on the athlete. They don't have any issues. They've done it so many times. They don't have problems. But typically for folks that have GI issues, the earlier you can eat, and with that amount too, the better off it's going to be. Again, if you want to choose something very simple, high carb, we're not looking at trying to maximize your protein, fiber, or fat. We're really concerned about really reloading a lot of your glycogen stores before the race starts, because it is going to be a long day out on the course. For some people, it could be up to 6 hours that you're out there. The average time is usually like 4.5 to 5 hours for female marathoners. So 50 to 100 grams of carb, or a little bit more depending on the person. Some people, they maybe will start off with a high carb drink. There's high carb drinks now that are anywhere from 50 grams all the way up to 100 grams of carb. So working on which option might work there. Just one that comes to mind right away is one by Martin. Scratch Labs has a really great high carb mix. I love the Scratch Labs ones. That's the one that I usually use. It's about 100 grams of carb. So I use that to start off with. Plus, like, you can do a bagel, half a bagel with a banana. There's also oatmeal you can add in as a solid option with honey, maple syrup, and a banana. What I try to not encourage is for people to just do a bagel banana with honey, because that's a lot of volume for some people. And so, depending on the person, you might be really, really nervous before. There might be a lot of anxiety. nerves happening. And usually when that happens, people are not hungry. So really finding options, again, that are low volume for that type of scenario. So I always encourage people to try out different options throughout their training cycle. So that way they can really hone in on what feels best to them and doing some practice races. So that way they can feel out what feels the best. Again, just going back to the weight loss, this is why weight loss strategies during marathon nutrition don't always fare well for people, because there's a lot of practicing of high carb scenarios that you have to work through to make sure that you can get through that race in a way that's going to feel most comfortable to that person.
Now, how important is like the dinner before meal? I've heard a lot of people who do like pasta parties and things like that. Are you focusing on that meal as well, or really just that 3 hour prior to the race meal?
So typically we do look at like their pre-race dinner, because sometimes that can be a big factor into GI issues. So again, it's going to depend on how much carbs somebody's going to need prior. So if I take a step back here and we look at carb loading, so carb loading is a re-emphasis of carbohydrates for about a 2 to 3 day period prior to a race, like a marathon, sometimes even a half marathon, depending on how long somebody's out there. So I always encourage people to consider their carb loading meats whenever we're factoring in how much carb somebody might need in a dinner. So typically per person, we're looking at 5 to 8 grams of kilogram of their actual body weight. So for some people, that could look like 450 grams of carb, 500 grams of carb over a 3-day period per day. So that's not for the whole 3 days, that's per day. Again, this is where we're encouraging somebody to prioritize carbohydrates for just 3 days. After that, somebody can go back to their normal eating pattern, but for 3 days, we're emphasizing carbohydrates. And then we're de-emphasizing, not removing protein and healthy fats and a little bit of fiber. Again, I want to repeat that because it gets really misconstrued that we just promote a bunch of carbohydrates. That's not true. Because of this big race, we're emphasizing carbohydrates and we're de-emphasizing, not removing protein, fiber, and healthy fats, because they're still needed as well for the athlete to properly function throughout the day too, and to actually have some satiety, fullness, and some blood sugar management as well at the same time. So if somebody's doing 400 grams of carb, their typical meals might look like 100 grams of carb plus snacks. So if somebody is needing 100 grams of carbohydrates in one meal, having something that they can easily digest is going to be key here. And sometimes some people can do pasta, no problem. But some people don't fare well with pasta. Sometimes it's too acidic for that person. Sometimes they choose a creamy sauce and that causes GI issues, or it's too buttery for them. So I always encourage even branching out beyond this pasta scenario. And that could be something like a baked potato with a pita bread and maybe like a lemonade. You can easily get 100 grams of carbohydrate in that one scenario with some chicken and maybe some green beans on the side. So very, very simple and straightforward. You can do the same thing with like a rice noodle dish. You can do a rice noodle dish with some tofu, some carrots, and let's say some cucumber in there. And then maybe you have something else on the side with it, like a spring roll. So some more really easy noodles that aren't fried. So thinking of a couple of scenarios for that person, depending on their preferences and their likes, what's available to them in a city that they're going to be racing in, is also very helpful for that athlete. Again, to even consider practicing prior so that they can execute it correctly.
All right, let's talk about how do we fuel during the race? Because like you said, it may take some people 4.5 to even 6 hours. So that's a long time. So what are some great things that they can grab while they're running?
Yeah, so some typical things that we encourage for like long duration forms of exercise is for people to aim for 50 to about 80 to 90 grams of carbohydrate per hour. So to do that, you can do a combination of fluid, gummies, gels, or people use blocks as well. So you can also use that. And there's a ton of them on the market now. It's been really nice to see that as a dietitian, just like these other companies providing different gel options. Again, I'd always encourage people to try out things. If your running friend says one works great for them, feel free to try it. But if it doesn't work for you, there's a ton of them out there. A great place to go and to be able to find new gels and gummies is thefeed.com. They have a lot of great options that are even 25 grams of carbohydrate per gel, all the way up to even 50 grams of carb per gel. So I always encourage people to try out different things. There's a lot of different consistencies out there, flavors and stuff like that. So don't get stuck on one thing and think it doesn't work for you. There's a ton of different options out there to optimize fueling.
Now, they've crossed the finish line. What do they do to recover after race day or maybe even like immediately after?
I always encourage refueling as soon as possible, rehydrate as soon as possible as well. Those are the two things I always encourage. So again, that can look like maybe somebody drinking a Gatorade, water, maybe water and electrolyte tab if they really need it as well. And then being able to drink something that's going to have some protein and carbohydrate is very key here too. So doing like a chocolate milk, or they can pack a protein shake that they like with a banana, or maybe like a salty thing. Cause usually people are so over sweet stuff after a marathon. They prefer salty things. So having a salty snack that they look forward to in their bag, like crackers, pretzels, a bag of chips, things like that might be really helpful to just start to regain themselves and then to get some of that strength back and then start off that recovery process as soon as they can.
Great. That is so helpful. All right. You've given us like a master class on marathon nutrition, and I don't want my listeners to feel overwhelmed. If you are working with a patient who is training for a marathon, please refer them to a dietitian who specializes in this, because as you can tell, very nuanced. There's a lot of numbers you didn't learn in school. So make sure you're leading the patient to appropriate information so that they can perform at their best. Now, Starla, I would love for you to give us some examples of some common nutrition mistakes that runners are making on race day. So maybe the provider who's, right in front of the patient or who catches that can correct it before any issues arise.
So typical things that I see is people using new shoes. I know this is like not gear related chat at all, but using new shoes that they have not trained it at all. That is a big mistake. Number two, I would say trying to restrict food because they're restricting their exercise. Typically, like 2 weeks before a big race, people will start to back off of their training and they reduce their volume and intensity. And so people can kind of get what they call taper crazies, and they overly fixate on their food because they're not exercising as much. So I always encourage people to not think about that as much as possible, and maybe to not weigh them. Sometimes that's also helpful too, to not provide the actual weight number. So that can also be very triggering for people. And so I always, again, try to reemphasize that we're deloading to reload the muscles. We're deloading on all of the stress and the training cycle, the volume. So that way we can give the body time to catch up and to reload a lot of that glycogen store as well for chronic usage over the training cycle. So sometimes even sharing it in that way is really helpful for runners, because then they understand what is the actual purpose of me not running as much and eating the same amount, if not more, when necessary, especially in that 3-day carb load, because it can get very uncomfortable. So being on the lookout for restriction or preoccupation of intake when they're de-emphasizing their volume. I would say the other thing I always encourage is remembering too that, what might work for you as a practitioner does not always work for the runner either. Every runner is so different. I've never given out the same thing to any runner. And I've worked with hundreds of runners over the last 5-6 years. And there has not been one runner that has the same nutrition or preferences as I do, or even the same fueling strategy. I prefer very different things from some of my athletes, and not everybody wants to do the same things that I want to do. So that is also, I think, very very key for practitioners to understand is everybody is so different in their preferences and how they're going to execute their race day. I'd say too, overlooking the dinner is a really big one. That sometimes is a big culprit of their GI distress during a race day. So really emphasizing simple carbohydrates are best. Processed foods during a carb load, they're just during a 3-day carb load. And then that person can just go back to eating how they prefer once the race is done and they're not training as much.
I think one of the most important take-home points is to practice before the race, whether it's new shoes, new shorts, or a nutrition plan, a gel, a drink, a juice. I completely agree with you that you got to practice because, like you said, just because it worked for their best friend Tanya, it doesn't mean it's going to bode well for them. And you definitely don't want to try something new on that race day because it can completely derail what you've worked for the last several months. So I think that's such an important message. And I'm glad that you had brought that up. Well, Starla, this has been so interesting. I've just learned so much from you. So why don't you share with my listeners where they can learn more about you and your services, where they can hang out with you on social media, and just how they can work with you?
Yeah, so everybody can find me over on Instagram. That is the main place that I like to hang out and play. So my Instagram handle is at running.dietitian.starla. And most people can find me there. I offer different courses, group programs, and then one-on-one services as well for people.
Well, Starla, thank you so much for being here. I would love to have you back on the show to discuss this in even more detail. But until next time, thanks again for your time.
Thank you. Bye-bye.